Hello, and welcome to today's webinar on the cost of living crisis in Scotland, Wales and Northern Ireland, which is hosted by us at the Centre for Progressive Policy and our Inclusive Growth Network as well. My name's Rosie Fogden and I'm Head of Research and Analysis at CPP, and I'm going to be chairing today's discussion. Before we start, just a quick reminder about what we do here at CPP. So we're an economics think tank and we champion fair and inclusive growth across all areas of the UK through our data-led research and policy development. And we're also home to the Inclusive Growth Network, which has been absolutely central to the report that my colleague Ross published today. And the network's an initiative supporting its 14 member places to lead on the delivery of inclusive local economies across the UK, including in Glasgow, North Ayrshire, Cardiff and Belfast from across the devolved nations. Before we kick off, please feel free to tweet about today's event using hashtag cost of living, @CentreProPolicy and @IGN_tweets. We're live streaming and recording this webinar, and we're going to be posting it on CPP's YouTube as well, so you can watch back again later if you want to. As I just mentioned, today's event coincides with the publication of new research by CPP looking at what the data can tell us about vulnerability to the ongoing cost of living crisis in areas across the devolved nations. Often analysis of the cost of living crisis is focused on England, and a lot of that is because of data constraints. But across and within the four nations of the United Kingdom, the effects of this crisis of rising prices aren't uniformly experienced, and social and economic resilience varies quite dramatically from one place to another and really shapes how the cost of household essentials like fuel, food and housing are affecting different communities differently. And the need for a more inclusive approach to policy making and a fairer economic growth model remains more vital than ever. So how are places across the devolved nations dealing with this ongoing crisis and building long-term resilience? And what can we share and learn from the challenges and initiatives taking place in Scotland, Wales and Northern Ireland? That's what we're going to be covering and discussing today. And I'm delighted to welcome and introduce a fantastic panel of speakers who will share their thoughts and insights on the challenges and initiatives surrounding the cost of living crisis in Scotland, Wales and Northern Ireland. So first we have Ross Moody, who's a research analyst here at CPP and the lead author for our new cost of living crisis report. Ross works on local economic growth and devolution and works developing policy ideas to reduce inequalities and strengthen the economic security of people and places. Carla Sabula is a senior analyst at the Joseph Rowntree Foundation. Carla supports the Scotland team at JRF to understand the scale and depth of poverty in Scotland. Councillor Hugh Thomas has been leader of Cardiff Council since May 2017. Cardiff is one of the fastest growing cities in the UK, and Hugh's administration is committed to creating a stronger, fairer, greener city through promoting inclusive growth and delivering major projects. And then last but not least, John Tully is Director of City and Organisational Strategy at Belfast City Council, with responsibility for overall coordination and portfolio management of Belfast City Strategy, the Belfast Agenda. So this discussion is going to last around 50 minutes, and then we'll go to audience Q&A. So we've actually invited pre-submitted questions, but if you have a question you'd like to ask it, please use the Q&A function on your screen. So really to kick us off, I'd like to hand over to Ross, who's going to give you an overview of the research and its key findings.
Thank you very much, Rosie. So yeah, just going to do a little quick run through an overview of the research which has been published today, what we've looked at and why, what the key findings are from our research, some interesting insights from the paper, just a couple of little teasers, and then also our policy recommendations as well, which we're calling for as part of this report. So I mean, the overarching question that we're trying to get out with this report is what makes places vulnerable to the cost of living crisis. And ultimately, we think it comes down to a few things. And the first of those is the risk of rising prices compounded the deprivation of those already in it. And for this, we've tried to look at sort of the areas of poverty and deprivation that really map onto where inflation is and the price pressures that people feel. So that's fuel poverty, food insecurity, and then we've also looked at child poverty, not least because it's very important, but also an all-encompassing metric of poverty for when we're comparing local areas. But it also, another important factor is the risk of more people being pulled into deprivation, and we think this largely is attributed to work-based factors. So within an area, the level of people who are out of work, so whether that be those looking for work who are on the claim account, unemployment benefits, those who are economically inactive, people in the working age population who aren't in work, whether that be through sickness, poor health, whether that be through caring responsibilities or otherwise. Between the two of them, they're both groups of people who are dependent on the state for their income. And we've also looked at low paid work, so the amount of jobs in a local area which you might consider to be low paid. And unlike previous reports that CPP have published on this topic, one thing that we've looked at this time is housing, other essential expenditure, which everyone has to pay for. Obviously, rents have gone up quite dramatically recently, and mortgage rates as well has been a very topical news story as interest rates have gone up. And we use all of this and bring it together and forms what we call the CPP's Cost of Living Vulnerability Index. And here, just in the graph below, you can see a very clear snapshot of Wales. And what this allows you to do is when we bring all these different indicators, you can see both for one local authority area, what a very brief overview of where the distinct pressures are there. So the way to read it, the greener a cell is, generally speaking, that's the things that are better relative to other local authorities with the same nation, and the darker, the more red it is, and the worse things are. But what this allows you to do, just a very, very quick clear snapshot, is allows you to see distinctions very clearly, both between and within places as well. And just to take you through some, what this actually looks like if you turn it into a map. So we've mapped it, and on the left-hand side, you can see Wales. You can see, only really tells you so much, but you can see there's, around the sort of coastal areas, there's distinct pockets of vulnerability, and also around the valleys sort of area as well. You can see that it's a bit redder, more vulnerable overall. Here's Scotland. Again, wouldn't read too much into this just at the moment, but so you can see, generally speaking, there's a little bit of a divide between west and east, and then also Northern Ireland as well, with maps here. And what you can see, Northern Ireland does, generally speaking, it's only got 11 local authorities, so there's only so much. But what you can see here is there is real variance between different local authorities and how vulnerable they are, and that will translate into people's actual experience on the ground. We tried to take this a step further in this report, sort of dig beneath these sort of headline stats and really think about what drives geography of vulnerability across the different devolved nations. And here, what we tried to do is categorize different areas within countries with the data that's available to us in a way that we think makes sense to reflect different experience. So firstly, we've looked at Wales. House of Commons has a classification which is publicly available about cities and towns, and we've made a slightly amended version of it, categorizing local authorities by whether, generally speaking, most people live in a small town or village, medium-sized town, or a city and large town. Scotland, we've done something slightly different. In the early research process, one of the things that we thought was quite interesting was, looking at the data, it seemed to be something about remoteness. So we've sort of framed it as, the more the sort of a sliding scale between areas in terms of how remote the populations had lived there. So non-remote would be somewhere like Edinburgh, Glasgow, where everything is accessible. Majority remote is the other side, so that would be like the Highlands and Hebrides, where most people are living remotely. And it's a scale that cuts across like that. Northern Ireland, we haven't been able to do that just because there's such a small number of local authorities. But what we've done there is go in depth a little bit more about the individual authorities. With that fewer number, that's something we've been able to do and still pull some interesting stuff outside of that as well. And our key findings by doing this, we'll just run through quickly. As I said, there's plenty more in the report. But one of the things that we've seen is there seems to be a relationship between higher fuel poverty rates in areas that may be a little bit more remote, smaller towns, villages, remote rural, island communities, particularly across Wales and Scotland, which is driven in large part what we think is potentially quite different factors. So firstly, in Welsh small towns and village, generally speaking, there's far higher rates of low-paid employment. Lack of grid connectivity in Scotland and Northern Ireland has meant that a lot of households here who are living off grid, a bit more remote, not connected to the grid, more dependent on alternative sources of fuel, which has been, the prices increased there a lot more steadily. Wasn't protected by the energy price cap, and support to get there was a little bit later. And we also think that persistent high food inflation is likely to compound food insecurity in remote places even further. This is largely due to higher transportation costs to get food to places, and also a lack of choice, meaning food turns up and you have to go for what's there. Vulnerability to relating to high housing costs, probably something you might imagine, generally highest in cities and large towns. Private rates are accounting for significant sums of people's take-home pay, especially in large urban areas. Much of the income in mortgage pain, I should say this is other analysis by Neil Hudson, independent housing analysis. It's a really great work, which we've looked at in tandem with our research today. But what that suggests is that the income in mortgage pain is likely to be concentrated quite heavily within cities, particularly capital cities of Belfast, Cardiff, and Edinburgh. And also on child poverty, one thing that I think is quite interesting, that there doesn't seem, looking at our geographic classifications, any sort of clear relationship that we can draw between child poverty and geography in the same way that we have with other factors. So I'll take you through, like I said, there's plenty more in the report to get stuck into, but just a few little examples of the sort of things that we try to look at and demonstrate. So fuel poverty and low pay in Wales. Here you see the 5 areas with the highest rates of fuel poverty going into the energy crisis. All of them are categorized as small town and village areas, and you can see that the 4 of the 5 here, on average, have quite significantly higher numbers of jobs which are local, which are lower paid. I think it's all of the areas that we rank as small town and village sit within the top 10 overall in Wales of the 20 or so local authorities there. It seems there's a very clear relationship between these two factors, meaning obviously you're going into the crisis with a high rate of fuel poverty. A lot of the jobs there are low paying. It's gonna cause you problems, and presumably would have been throughout the more energy centered period of this crisis. Similar sort of trend, like I say, we see that in Scotland with remote living. You look at this chart, so these are the 3 different poverty-based factors that we've looked at as part of the analysis, and we've sort of categorized them here by the geographic categories that I talked about earlier on. And you can see when it comes to fuel poverty, there seems to be a bit of a relationship between when you get more remote, it seems to be that coincides with a higher rate of fuel poverty in these areas. And actually, the 3 areas with the highest rates of fuel poverty, Hebrides, Highlands, Argyll and Bute, are all areas with really remote populations. And housing in Northern Ireland is something that is quite interesting. Northern Ireland, on national records, has the highest rental price increases compared to any of the nations, of about 10%. But if you actually break it down sort of more granular geographic level, you see that there's massive variation within Northern Ireland itself. Inflation in local rent prices, it doesn't conform to any specific geographic trend, because if you look, even places like Belfast, which have the highest rental costs, it isn't necessarily seeing rents inflate as fast as some other areas. And Derry City in Strabane, second largest local authority in Northern Ireland, saw the lowest levels of rental market inflation over the past year. So really quite a lot of variation, which, when you go beneath the national level picture, very, very, very varied. And obviously that's going to be playing out quite differently across the different local authorities. So that's a little bit of a snapshot of what we've looked at. And that's all fed into our policy recommendations for this paper, of which is 4. The first one is about flexible local funds. Basic idea that any future cost of living support funds, which is administered through a local authority, should have a good, significant size discretionary element to it. That will allow councils to better tailor the interventions which they're developing to tackle the very unique challenges they face in their areas, particularly where sort of national level support schemes, things around the welfare system and cash transfers, which are seen, has been the preferred option, might not necessarily be able to tackle some of the issues that we face. Second one, quite fundamental, we need better local data. It's been pretty difficult in the research process actually being able to craft a story out of this, because some of the data is so out of date. definitions of the same thing can often be really, really different between the different countries. So it's quite hard to compare and contrast. I think there's a really strong case for updating data, the governments and statistical agencies coming together to work on that. And also trying to work to align different definitions of poverty together to support comparisons across borders. We also spoke to a lot of local leaders throughout the duration of this research, and time again, data sharing. Very, very important, very integral, but that sort of streamlined process in a moment of crisis to get local authorities working with different organisations to get that infrastructure in place to share data to better understand what's really happening on the ground. It seems a bit slow, and that is a complaint that a lot of people have. We think there's a really strong case to streamline the process in the same way that we did during the pandemic, but have a set framework for all crisis interventions for the future. And the last one is about spatial impact analysis of policy. So in the same way that when a government introduces a policy, especially sort of support funds, there will always be analysis around different household types, income levels, demographic groups. We think given the variation in our analysis and some of the support measures that have been introduced, that there's a really strong case to do similar sort of stuff around spatial lines to better understand the limits, both of universal and targeted support schemes and supporting different communities, and also where there are barriers to support, to inform thinking on how best to overcome those local barriers and to provide more nuanced policy where you need it. So whistle stop tour, as you say. The report is online. It's all there to be seen. We've got a good panel here. And I think that is everything from me. I'll hand back over to Rosie.
Thanks, Ross, for whizzing us through that report and all the analysis that you've done. I'd like to now invite Carla to talk a bit about the challenges and initiatives taking place in Scotland.
Hi, thanks for having me today. I'm Carla, I'm from JRF. I work in Scotland. Yeah, I think the report is really striking and show how across Scotland, different communities are being impacted by the cost of living crisis. And even though these drivers might vary across the communities, there's not really one local authority that can look and say, there's not a cost of living crisis risk here. I mean, I think it was clear the way that you structured it, that there's some part of that, which is about some local authorities already having a higher risk of poverty. These people and these local authorities are already vulnerable to rising costs, and this is just going to further their need to sort of cut back and reduce to overcome this. At JRF, before the crisis, families were already telling us that they were carefully juggling their household bills. And for low-income families, this has just become even harder, if not impossible, with lots more falling behind on bills and things. Just last week, our End Poverty Scotland group, two low-income families from that had said that they'd never actually fallen behind on a bill before, but this winter was the first time they'd ever sort of had to go into arrears. And I think it just shows the way that this is sort of building up pressure on families. And I think they're also losing hope for what's going to come this winter because they feel that there maybe isn't the support that they need. Another really striking thing was about the remote and rural communities that Ross highlighted. I think in Scotland there's a bit of a idea that there's less of a risk of poverty here, and that's maybe because the overall poverty rate is lower. But there's definitely these pockets of poverty within there, and you can't forget that there are low-income families living in these more rural areas. But yeah, here again, it's highlighting that even if you're in an area that might have a lower poverty risk, that there's all these other drivers which mean that it's harder to have the resilience you need to be able to deal with all these very, increasing costs. Again, this is another thing that's come up in our group. We had a member in our End Poverty Scotland group that had previously lived in a very remote and rural part of Scotland, and they told us how a lack of choice had meant that individuals had had to pay so much more for really essential things. And I know that every year when it came to getting new school clothes for our children, she just really, really struggled because there wasn't really anywhere else to go to shop. You just had to spend the amount that was being offered. They had also told us about how the issues with heating was really, really prevalent there. Particularly this fact that they relied on heating oil, and that meant that they had to sort of buy in advance and in bulk, which made it really, really difficult to sort of budget for. And again, it was really striking that this came out in multiple of the devolved nations. So I think it's really an area that we need to think about. I was also really pleased to see housing costs included in the report. So we know that renters are most at risk, particularly private renters, with costs for new lets having absolutely soared in Edinburgh and Dundee. And it means that anyone who's like starting to rent now means that they're just facing such high costs that they wouldn't have been experiencing prior to the crisis. So although the overall rents might not seem as drastic, the sort of new rents are really, really worrying. And also, I was quite surprised actually at some of the findings that you showed about mortgage holders. Obviously, this has been in the news, but some of the places that were highlighted were not where I would have thought. So obviously, Edinburgh is known for having high cost of housing, but seeing Inverness and Perth really showed that this is something that's going to, you know, we need to be really aware of now, because it's going to come up and sort of get us soon if we don't think about it and don't come up with a solution. So yeah, I just thought it was really helpful to see that there is this variation across local authorities, and you know, there's different drivers, but that you can't really look at it as not an urgent problem that needs tackled now. From your recommendations, and as an analyst, I should say, working in Scotland, I strongly agree with the need for up-to-date data. This is absolute, you know, always pulling my hair out. And I can imagine if you're working on the front line, this is just even more frustrating. It feels like you're always in a sort of catch-up mode, and it means that your data is so behind you can't really see the warning signs, or the warning signs appear too late, which is just, you know, a total challenge. And as you said, it's great to see local authorities using innovative ways of using data, but it would also be great to see that being shared more, particularly with administrative data where people are collecting it anyway. And also drawing on information generated by other organisations. And this report was really great to see all the different types of data pulled together in one place, even though I know it was a challenge to get there. So yeah, I think that's sort of my overall summary.
Thanks, Carla. Yeah, I think the points around data sharing and up-to-date data are kind of, they're almost feel like they're repetitive to say, but particularly in this kind of instance where we've got a situation that remains so relevant and is really fast moving and is, as you say, throwing up like different pockets and places than are the ones we might traditionally expect to be less resilient. I think it's really important to have some of that more up-to-date data and be able to interrogate that. But anyway, I'll pass on now, and before we get into discussion, to Hugh Thomas to talk about Cardiff and Wales.
Yeah, thank you. Really interesting data there from Ross, and I think what struck me was the fact that actually Cardiff didn't seem to be an outlier in many of the statistics, which I think reflects the kind of duality of Cardiff, and I think you do see this in cities elsewhere in the UK as well. In that certainly Cardiff, is an economic powerhouse. We account for over 20% of the Welsh economy. A rich city, but also within the city there is huge inequality and huge poverty. So if you were to take what we describe locally as the southern arc of Cardiff, so it stretches from a large housing estate in the west of the city through the inner city, old industrial areas in the Docklands, to another area of council housing in the east of the city. That area with a population of over 60,000 would, if it was a standalone council, would be the poorest council in Wales. And so certainly particularly in those areas, but also with pockets elsewhere, we are absolutely seeing the cost of living crisis biting and having a disproportionate impact on the city's most vulnerable people and communities. And fair to say that the scale and complexity of demand for services post-COVID has only accelerated. I guess there was a sense, a hope at least, during the kind of lockdown period that there would be a lowering of demand in services as things got quote unquote back to normal. Quite clear now, 2 years out, that's not going to be the case. Compounded, of course, by the high inflation and the cost of living crisis engulfing the UK, which is also having, in turn, a major impact on council budgets and the cost of us to deliver services. So I think it was mentioned at the outset how we want to create a stronger, fairer, greener city. That's the strapline of my manifesto last year, and now our policy agenda, and that has put inclusive growth at the heart of it. But we've been forced, in particular, to respond to the cost of living crisis over the last 18 months, and using some discretionary funding in particular ways. For example, by opening warm welcome spaces in our libraries and in our hubs, which over the last winter supported almost 12,000 people. We have a really well developed money advice service and into work service that's kind of delivered through communities in our hubs. So we enhanced the provision of both of those in the face of unprecedented levels of demand. One of the pieces of work that the money advice service does is support people with benefit claims and help them tap into unclaimed benefits. And last year alone, we helped claim an additional £20 million of weekly benefits that were going unclaimed, and that figure every year, exceeds 15 million pounds. So it just shows, one, the complexity of continuing complexity of the benefit system, that people are still unable to access it, but also the importance of having a program like that within a local authority to help people. So over 6,000 people in Cardiff assisted with their universal credit claim or with COVID related financial support, and that was in the last financial year, and that was double the number expected at the start of the year. And then we're also continuing to work with residents to support their journey into work through education and training. Our into work advice service in Cardiff functions in effect as an employment gateway, helping 77,000 people in the last year receive into work advice. And that, in combination with a scheme called Cardiff Commitment, which works with businesses to get them into schools and advertise opportunities, work experiences, placements, apprenticeships into our schools. Those have helped us in Cardiff reduce our NEET figures for post-16, not in education, employment or training, from over 10% 10 years ago to below 2% now. So some real progress being made despite the bleak economic background. And I know that other councils in Wales, and I think a few in England, are looking at the Cardiff Commitment model, because we've now got over 300 businesses signed up to it, with the council acting as the broker, if you like, in placing the opportunities that businesses are creating or offering in the city in front of our pupils, particularly because we're in control of the scheme, particularly targeted at children from in more deprived communities. And the other thing I just want to mention very quickly is our work on being a living wage city. Cardiff, I think, is the first council in Wales to become a real living wage employer in 2012. We've established a living wage city coalition, and really reaping the rewards of that. Cardiff University calculated has helped put an additional £50 million into the Cardiff economy since 2012. Over 40% of all accredited living wage employers in Wales are based in Cardiff. 66,000 people in the city work for accredited living wage employers, and 11,000 of those received a pay rise as a result of their employer accrediting. So there are certainly some strategies that councils can deploy in response to the cost of living crisis, but it goes without saying that a fair funding settlement from government, and ultimately it is the UK government, is essential, not only because councils provide a service of last resort to people, and that costs money, but also because we can prevent issues from escalating to a crisis point in the first place, which if we do that avoids a whole lot of further costs to the state. I've probably taken up too much time, so I won't mention housing, but I'm sure that that will come up in the questions. And like everywhere else, we are seeing huge pressures in housing and homelessness, and taking some actions as well. But I'm sure we'll cover that in the questions. Thank you.
Thanks, Hugh. Yeah, and we can definitely look to cover housing in the questions in a little bit. I think it's really interesting to hear you reflect on the demand for public services and council budgets post-COVID, which just, is really keeping up the pressure on local government. And it kind of, you're so right, it hasn't let up for the last few years, and it doesn't seem to be, getting much better in the near future. But I thought you had some really great positive examples there of the Money Advice Service and the Living Wage City Coalition. I mean, paying the real living wage is something that at CPP as an organisation, we've always been very in favour of, and it's been a kind of a core ask of a lot of our good work, policy recommendations and research. Obviously takes on a whole new dimension in the high inflation environment that we're in now, in terms of how much the real living wage has to go up to actually be able to afford someone a good standard of living. So I think that's going to be quite interesting to follow the development of in the next couple of years, I think. But anyway, let's turn to Northern Ireland, and I'll invite John Tully to share with us his insight on Belfast. Thanks.
Great, thank you very much, Rosie, and thanks very much for the report. I think that from a Belfast perspective, the timing of this report is really, really helpful, because we're actually in the process of refreshing our city strategy, the Belfast agenda, and certainly the findings in your report really do resonate with what we've seen as part of our engagement across the city, as we've reached out to communities and get an understanding of the impact of the cost of living crisis on the things that they're thinking about most in the city. I suppose just to start, to paint a little bit of a picture about Belfast in terms of its role in the region. We have over 247,000 jobs in the city, and so it's very much the business and employment hub for the region, and it generates about 30% of the GDP for Northern Ireland. So really, the success of Belfast is critically important to the success of the wider region. And really, we are trying to create the right conditions to accelerate that inclusive and sustainable growth as part of that city strategy, the Belfast agenda. And certainly, whilst we're seeing some really good progress, there still remains quite a few issues, and many of those are picked up in your report. So certainly the first one I would emphasize is the levels of economic inactivity and some of the causes of that, and certainly the number of people who are economically inactive, particularly due to health reasons, is a significant consideration in the Belfast agenda, and making sure we understand the barriers that people face in terms of entry into employment. So certainly themes like the rate of employment for those facing disabilities is a particular challenge for us, and we would certainly hope to target that as one of the cohorts through the Belfast agenda. So as we put the final touches to the Belfast agenda, we're certainly looking at how we would reduce the levels of economic inactivity and put specific targets around that will be informed by our focus on inclusive growth as we do that. And obviously putting together the approach to employability and skills in response to that, and creating really inclusive pathways for people to enter into the workplace and providing them with really tailored support will be an important part of that. So turning to housing then, and certainly we're seeing in the city increased levels of housing stress, which is really down to the growing demands for family accommodation and accommodation for older people, and seeing that demand is really placing quite a lot of strain on people in the city. And through our city leadership role, we're working with partners to make sure that there is a coherent response to that. And we're using our local development plan, the spatial plan for the city, to drive a really strategic approach around social and affordable housing. And we're also working with partners to identify locations across the city that can be developed for housing, and give a much stronger focus around things like city centre living, which has not been at the same level as other cities in the past. And alongside that, we're also looking at how we physically redevelop the city and put in transportation infrastructure, because we do recognise that those are really key levers for low-income people, to create that sense of connectivity between the city centre and communities, but also to give increased access to amenities as well. And of course, the area of fuel and food poverty is something that we've seen as well, and I know that you've highlighted that in your report, and certainly we would emphasise that the level of earnings in Belfast does lag behind some other parts of the UK, and then the impact that the increase in rental prices, for example, the impact that means for people on the ground is significant, and we're seeing that as being a theme right across the city. And I suppose it emphasises the importance of taking that place-based approach to make sure that we understand the way in which things like housing and transportation and connectivity all interconnect in terms of the impact on those most vulnerable people that are facing poverty. One of the areas that we've done a considerable amount of work is around that immediate response to the cost of living crisis, and there certainly has been a strong emphasis around the provision of financial assistance through a fuel hardship fund, and we've also been doing quite a lot to raise awareness around the assistance that's available to everyone in the city through existing support mechanisms, but also focusing in again on that food poverty, looking at things like social supermarkets to make sure that there is help for very vulnerable people that are facing the immediate pressures of that, and looking at initiatives that relate to fuel poverty as well in a very practical way. So I suppose just turning attention then to the longer term approach, we're certainly focusing very much on how we would build that resilience as a city, and looking at how we embed the response to poverty and inclusive growth into the city strategy. And we have appointed a very senior post as the head of inclusive growth and anti-poverty within the council, that works with partners to drive forward that agenda and place it at the heart of all of the work that we're doing. And just by way, a couple of examples of the work that's been done there. We as a council have achieved the real living wage, and we're the first local authority in Northern Ireland to do that. We've put together a social value procurement framework as an organisation, and we've created, in effect, a city charter, the Belfast Business Promise, which looks at how we can have a call to action right across the city with a lot of the large and small organisations that employ large numbers of people, and looking at how we can create that pledge around good, secure jobs, and support local and social economies, and protect the environment as well, which is another key developing theme there as well. So that Belfast Business Promise really is something where we're hoping that we can get the effective scale right across the city, with other employers taking a similar approach to us as a council. We've also created an inclusive growth index, which is really about looking at how we measure the responsiveness to inclusive growth. And that picks up on a lot of the themes that are identified in the report, things like child poverty, things like housing and the cost of housing to very, very vulnerable communities. And it looks at how we create those inclusive labour markets as well. And of course, we will be tracking that to make sure that our response as a city to inclusive growth continues. And alongside that, there is a framework, the Inclusive Growth Toolkit, which will very much focus on how we embed our response to inclusive growth and poverty into all of our policies, programs and services. And again, as we develop that, we're very happy to share that with others to make sure that other organisations take a similar approach. We've worked very closely with Queen's University in Belfast to identify those specific cohorts of people that we want to target as part of our inclusive growth work. So again, each of those interventions will make sure that we're giving that added focus. I can remember whenever we first spoke to Preston about their approach to community wealth building and inclusive growth, they said that it was the work of many hands. And I think that that's very true of the work that we're doing as well. I think everyone has to play their part in terms of developing that response. And we're very mindful of the key strategies that need to be delivered at a regional level around childcare, around mental health, and around anti-poverty, for example. And we're very keen to support the implementation of those, but we do need those regional strategies to be in place to make sure that this is completely successful. The theme around data has been discussed a number of times, but certainly the comments so far really do resonate with us as well in terms of the practicalities of getting timely information shared in a way that helps all the agencies in that overall response. And being able to share the data and the best practice, I think, is really, really critical to the success. So thanks once again for the report. As I said, is really helpful. It really does shine a light on some of the big issues that we're grappling with. And it is a really important time to be shining that light, given all of the issues that we're facing. So I'll hand it back to you, Rosie. Thank you.
Thanks very much, John. And thanks to all of our 4 speakers today, Ross, Carla, Hugh and John. Before we turn to audience questions, I'd quite like to open up the discussion with all of you as a panel to get your thoughts on what this research means kind of for people and communities in reality. Perhaps it would be good to talk about housing first, because this is something that, it's got a lot of media attention recently, and it looks like it's an area where pressure is only going to increase, with Bank of England, increasing interest rates and markets predicting further rate increases as well to over 6% by the end of the year. Hugh, I know that you kind of maybe wanted to reflect on the housing situation in Cardiff, and it'd be good to also to know how you think that rising mortgage costs are actually affecting renters in Cardiff as well.
Yeah, well, we are certainly seeing a significant increase in demand for homelessness services. 4,500 households sought homeless assistance in the last year, which is a 13% increase on pre-pandemic levels. But what is fundamentally driving this, in my view, and the interest rates increases is part of the mix, but actually it is the gap between the cost of renting in the private sector versus what is currently funded through the local housing allowance. Following successive cuts or freezes of the local housing allowance over the last 13 years, for a 3-bedroom property in Cardiff now, the gap between the local housing allowance and market rate is about £400. So that is clearly pushing more and more families into housing poverty. It is forcing homelessness, and in turn it's putting more pressure on council services. And we were in a position a few years ago where we didn't have to use at all, be it bed and breakfast and hotels as part of temporary accommodation for homelessness. I think we are, with most of the councils now, having gone back to that position of needing it, and we are full to the gunnels in terms of accommodation. What we are doing is building homes of all tenures as quickly as we can. A really ambitious local development plan that is actually in the process of being renewed. But the one we set back in 2016 targets 44,000 new homes. A quarter of all new homes granted planning permission since 2017 are actually affordable ones. And we have, in particular led by the council, one of the biggest council house building schemes, I think it's fair to say, in the UK. So we've delivered nearly 1,000 new council-built, council-owned properties for social rent in the last 4 years. Our target for 2030 is to build a further 4,000, and some of those homes will be actually for market sale. But we will then reinvest the profits into building more council housing. That's obviously a longer term project. The demand, because of the cost of living crisis, is particularly acute right now. Yeah, very, very aware of that.
Yeah, and I think that's something we're seeing kind of across all of these issues, like across the whole of the UK at the moment, is, you know, there's an immediate term crisis which needs addressing, and there's also, you know, that's also a symptom of a much longer term problem which probably needs some investment to fix the longer term problem. But that issue of housing allowance, I think, really feeds into the wider, you know, the wider issue with this, with the immediate problem of the social safety net. So as the report also outlines, we've seen the number of people receiving universal credit rise steeply in Northern Ireland since 2020, and in general, you know, more people are relying on state support. But as you know, research including by Joseph Rowntree Foundation has shown, you know, that support quite a lot of the time isn't enough. You know, 90% of low-income households are on universal credit, are currently going without the essentials, I think is the JRF stat. And at the same time, we've kind of had recent announcements from party leaders, including Keir Starmer, on keeping the 2-child benefit cap, which is, you know, something that academics have called a poverty-producing policy. So kind of, you know, what can and are devolved governments and councils doing on this kind of issue of social safety net? I don't know, Carla, perhaps you could reflect on that a little bit.
Yeah, thank you. Yeah, I think the growing numbers of families relying on universal credit, either as their total income or as topping up their income from work, when universal credit just isn't sort of taking into account the costs of actually living, and we've found that the basic rate just doesn't cover the cost of essentials, which is unacceptable. And, you know, it feels like the system is almost pushing people into poverty. And that is not how a social safety net should be. I think in general, thinking about how local places have responded, I know earlier this year, Trussell Trust and IPPR Scotland highlighted the need for local authorities to use their crisis grants with more responsiveness, with an amount that actually stops a spiral of crises, and with flexibility. And again, they highlighted variation in all of these characteristics by local authority. And I really feel like your recommendation in the report and the findings of the different drivers of the crisis across local authorities really highlights this need for anyone giving support to be really flexible with the support they give, and also probably supports a cash first approach where people can spend it on what they need rather than just providing, you know, vouchers or something like that. I think we've heard that the Scottish Child Payment is making a difference. It has been filling the gap between the money coming in and rising costs. But I definitely think in our End Poverty Scotland group, the parents who got it in the first phase for the under 5s were feeling more like it was providing them with more income, whereas now it's got to the stage that it's sort of just filling a gap, and it is feeling, you know, they feel lucky to have it, but also it can be a real challenge. Yeah, and on the 2-child cap, I mean, it's just unacceptable. We've seen poverty rates for large families growing across the UK, and in Scottish Government have highlighted that as a priority group to target to reduce child poverty, and there's just no need for it. All the evidence points to it being ineffective, and it's also driving poverty. So that's probably everything I have to say. Thanks.
Yeah, thanks, Carla, so much for that. I think perhaps we should try and bring in some audience questions now as well. So I think people are, and you can still submit questions via the Q&A function on Zoom. And we've also got some pre-submitted questions as well. So perhaps it'd be quite good to start with a question on data sharing, as that's something that, you know, a few of a few of the panelists have talked about, and that's one of our recommendations as well. So, you know, more data sharing across local organisations, you know, for example, food banks, utility companies, local government, can really help to target policy interventions. So, you know, what would you say the barriers to doing this are in practice, and what kind of benefits have you seen of this kind of data sharing? And perhaps we could go to John on that one.
Yeah, I suppose my initial thoughts on that, Rosie, is that, you know, we've proven the value of taking this approach, both at a very practical operational level during the response to COVID, where we were able to share meaningful data between agencies and formulate a response based on that. But with longer term issues, like some of the work we're doing with those with very complex needs in the city centre in Belfast, you know, we've proven that there is a way to practically share information that really does benefit very vulnerable people in the city. So certainly, you know, from my perspective, it is about identifying those priority areas where there is a need to share the information, and look at where we need to identify proxy indicators as well, because quite often the data that we see isn't updated frequently enough to allow us to plot meaningful changes. So certainly, I do think that we've proven that it's possible to share data in practical terms. I do think that being able to paint the picture, both with the qualitative and the quantitative data at a very local level, really does help to focus everyone's attention in on those areas of most need. And it does, I think that Ross used the term about crafting the story a little earlier in his presentation. You know, being able to craft that story at a local level allows a much stronger set of interventions to be designed and then delivered. And certainly as we finalize the indicators that we're going to be using to monitor inclusive growth, you know, we would hope that that will allow us to be able to be clear about where we're being successful and where we need to continue to focus our efforts to turn the curve. And, you know, looking at things like child poverty in particular, you know, whenever we're targeting specific interventions around that, you know, we'll be calling on all the partner organizations in the city to work with us to, you know, to identify those things that we would measure and get the mechanisms in place to share the data in a practical way.
Thanks, John. Hugh, did you want to come in on that one as well?
Yeah, just very briefly. In Wales, we've got public services boards, which were established by the Future Generations Act in the Welsh Parliament. So I chair the one locally in Cardiff, and that's got all the major public service providers, named, you know, in particular council, health board, police, probation, and Natural Resources Wales, our environment agency, all on a committee, you know, looking at citywide issues, and we have had, you know, conversations in those meetings around data sharing, and you know, sometimes there have been blockages, but actually the existence of a group like that enables some of those blockages to be unplugged, and then actually quite rich data to be brought to bear on some sticky issues within specific communities. So there are ways I think you can enable data sharing locally. I absolutely take the point about standardizing data. You know, even Wales wide is not straightforward, and I think certainly UK wide I think is a challenge. And I think the more that policy professionals like CPP are making to the various agencies out there to the need to have standardized data so we can compare apples with apples, then I think that the better for it.
Thanks, Hugh. Did anyone else want to come in on that one, or shall I'll move on to the next question if not? No? Okay. So another pre-submitted question that we received was how the cost of living crisis has impacted health outcomes, and where should local government and the health sector be working together to prevent the further deterioration of health outcomes that are being driven by the crisis. So I think, you know, this kind of plays into your point, Hugh, about public service boards and, you know, different public services working together. But maybe Carla, I'll come to you first to reflect on that one.
Hi, thanks, Rosie. Yeah, so earlier this year and the year before, we've done 2 surveys on the impact of the cost of living crisis in Scotland. One was in summer of 2022 and the other was in spring this year. And we had a sort of focus on health impacts and also how people had reached out to services to deal with that. So we found that 7 in 10 people who had a negative impact on their mental health due to the crisis, and 1 in 3 had seen a negative impact on their physical health. And what was quite interesting was that for sort of middle and high income households, we didn't see a huge amount of change, and for some it had actually gotten better between the summer 2022 survey and our survey this spring, but the situation had really gotten quite worse for low income households. And I think this sort of shows that the initial worry around the cost of living crisis and the scale of it, people weren't sure how it was going to impact them, but ultimately it's the low income households who have really, really sort of taken the brunt of the crisis. Some high-risk groups beyond low-income households included people accessing food banks, single parents and large families. In terms of food banks, we saw like quite a high increase in people accessing or saying that their physical health had declined. And I think that's, you know, one of the things we don't really think about is the fact that when people are really cutting back, these are going to have long-term impacts. It's not just something you do once and it doesn't have a long-term impact. It does have a long-term impact, and often on your health. We also find that people really are accessing health services to deal with it. So we found that 3 in 10 people had gone to a GP about their mental or physical health, of people who'd said that it declined because of the cost of living crisis. And they'd also reached out to other services. So we'd asked about people accessing hospitals for either mental or physical health. But GPs tended to be the first port of call for people to get support. And sort of from people's personal experience, we heard lots of our groups of people who are currently living in poverty saying that it's having a really long-term impact on their mental health, having to constantly juggle between, you know, worrying about bills, trying to make ends meet, trying to fit work in, trying to look after their children, and they're just struggling to cope. And we've also, one of the parents in our group has a disabled child, and she had been trying to cut back on meat because meat is expensive, and her daughter got less well again, so she had to start buying it, and she's like, what am I meant to cut out? How am I meant to cope? So I really think that people have been accessing services, but the cost of living crisis is going to have a really long-term impact on people's health. So yeah, I think that's how we've seen it play out.
Yeah, and I think that's interesting because it feeds into that longer term picture as well. This only adds pressure to the NHS, to public services, to GPs in the longer term as well, and to the limited extent that we have kind of mental health services available, it's adding pressure on to those too. So it's something that, you know, is really important for policymakers to address. But another question we've had, which is very related, but kind of a different spin on that question, is, you know, given the rising levels of economic inactivity due to mental health issues, you know, what can be done to support people back into the labour market? And you know, my reflection on that being that is particularly important in this context of a, you know, cost of living crisis, because we need people to be able to support themselves, because the state support just isn't there really a lot of the time. Is there anyone that would like to come in first on that one? So yeah, thanks, you.
I mean, there's no easy answer, right? I think to the point on data, it starts by understanding why are people economically inactive, you know, and the figures I've seen for Cardiff show that, you know, a pretty chunky proportion are actually students, but then there's those with caring responsibilities. So I think you then start to have to unpick the question about, well, what could the state at any level do to support with caring activities so that people can go back into the workplace. And much of that speaks to childcare, you know, and the cost of childcare being prohibitive. So encouraging, you know, people to not work and instead look after young children. There are routes to encourage people back in, and I mentioned the work of Interwork in Cardiff, and that includes training and whatnot. And actually what we are seeing, I think, universally across the UK, certainly in Cardiff, is that there is actually strong demand for employment, particularly within local government. You know, most of my departments here are stretched for resources. Likewise in health, so there are jobs there. There is an economic upside if we can crack that nut of how do we get people who are economically inactive but eager to work into work. But I think it's a support package around it, and you know, there has been some really interesting research of late into childcare in particular, and how, you know, if you funded a more extensive free childcare offer, you'd recoup the cost of that through increased tax revenue. But that requires, you know, the UK government prepared to grasp the nettle. Yeah,
thank you. And that's something that's close to our heart at CPP, and that we've done lots of research on ourselves. So I'd encourage any webinar listeners to visit our website and see what we've got on childcare. But that is all that we have time for today. Please continue the conversation on social media, and we'll share a recording of the event shortly as well. Just wanted to say a massive thank you from me and from CPP to all of our speakers, Carla, Hugh, John and Ross. And thank you to everyone for joining us online today as well. We hope to see you at future CPP events. Please sign up to our newsletter for all of the latest research and information, and have a lovely afternoon. Thanks.